All right, we're turning now to our skies, or more accurately, the people who control our airplanes. A group of researchers at Southern Illinois University Carbondale have been looking at the mental health of air traffic controllers. It comes after months of high-profile air crashes and near misses. So we have Amy Rutledge, assistant professor at SIU and one of the study's lead researchers, joining us right now. Amy, thank you so much for being here. Let's start off with why you wanted to do this study. What was the gap in research that you all had noticed?
So traditionally, when we speak about mental health in aviation, we focus on the pilots, and air traffic controllers tend to be left aside out of that conversation. And we decided that we need to really start to focus on them and shed light on their situations and try to provide them a voice and allow them to be seen as well.
And this is personal for you. I mean, you're a former air traffic controller yourself. Can you talk a little bit about what your experience was like when it came to mental health and it being addressed in the industry?
So I only spent 5 years as an air traffic controller in the United States Marine Corps, but one of my co-authors is actually a current air traffic controller. The two of us together have experienced just the culture of not being free to speak up. There just tends to be a culture of fear when it comes to mental health because if we do admit to having a mental health issue and we're diagnosed with one, then we lose our medical clearance to control, which means we've lost our job.
Wow, so I can see how that would stop people from saying anything. And it seems like such a high pressure, high stress job. So, if you have this fear hanging over you, how do you even go about surveying air traffic controllers for this study? What did you guys do?
That was a challenge. So, what we finally came up with was an anonymous survey, and we incorporated in that survey a GAD-7, which is assessing the anxiety. It's a self report assessment, and a PHQ-9, which is also a self report assessment for depression. By allowing them to report this anonymously, then they were not afraid of any sort of retribution or anything that would happen to their medical clearance. And then we were able to get that to controllers through people that we know who are currently controlling, and then asking them to also share with people they know, and then also putting that into social media groups that focus on air traffic controllers.
All right, so what are some of your preliminary findings telling you from all of this?
So, preliminary findings are indicating that 1 in 5 are reporting moderate to severe anxiety, and over 10% are reporting major depression. Both of those values are significantly higher than the general population. And we have more data analysis that'll be put out for publication later this year.
Does that shock you, those statistics and those findings, or was that what you expected to see?
Honestly, it's kind of what we expected to see because they are working an extremely highly complex job that is exhausting. They're critically short staffed. So they're working 10-hour days, sometimes 6 days a week. And studies show that burnout tends to help anxiety and depression manifest in people. So that it was expected.
Well, the US Department of Transportation says we need about 3,000 more air traffic controllers right now. So, in your opinion, what needs to happen to help us meet that number?
So currently, the FAA has done some amazing things to try and meet that number. They've started the Enhanced Air Traffic Collegiate Training Initiative, where they're essentially decentralizing training from Oklahoma City and allowing higher education institutions to become certified providers for that training. So higher education is not replacing Oklahoma City, but they are allowed to supplement that, which is going to open the door for more people to become air traffic controllers, and it should increase the throughput. Unfortunately, it does take up to 3 years to fully train and certify a person as an air traffic controller. So, although they've made some strides, it's still going to be a process to try and replace and increase the number of controllers that we have.
And when we think about some of the challenges that are standing in the way of treating mental health of air traffic controllers, I mean, am I overstepping to say it would make sense to take away the idea that you could be fired for this? Or what's your opinion? What needs to change?
There is a definite culture of silence. And so there's no easy solution to that. Um, One of the things that the FAA has done is increase the number of medications that people can use to treat mental health disorders. However, they have to be on those medications for 6 months and stable, and it can take another 2 years before they get cleared to control again. And during that time, they're not being paid. So, considering the current economy, It makes sense why people tend to be quiet as opposed to reaching out for help. I think perhaps maybe confidential peer support networks need to be increased, talk therapy being pushed as an alternative to medication, things along those lines.
Could all make a huge difference and could all impact all of us as we travel through the skies every single day. Amy, thank you so much for your time today and for your research. We really appreciate this.
Thank you.
For you guys at home, we have a link to the full study on our website. Just click on the As Seen on TV tab at the top of WQAD.com.